want to be back in the roast arena or talking about people. I don't have the time or the energy or the patience for any of that. But I do actually want to address ladies, and I want to talk to you about heart disease. You know, heart disease is a silent killer in women. It is a very silent killer in women because a lot of times we ignore the signs and we ignore what's happening inside of our bodies because we relate it to normal stress of, you know, running a household, or maybe your job, or taking care of children, or raising teenagers, you know, whatever the case may be. A lot of times we take what's going on with us and we relate it to stress, and we overlook the possibilities of what could truly be going on. So it was back in 2016. I was out of town. I was with Tiffany, as a matter of fact. Tiffany and I were out of town together, and I don't know what happened. I woke up and everything around me, like the room was spinning, and I felt like I couldn't breathe. I felt like I was going to pass out at any moment. And Tiffany and I were in a hotel room, and she was asleep in the other bed, and I remember like I was gasping her name, trying to get her to wake up. And when she woke up, she's like, "Oh my God, what's wrong?" And I'm like, "I don't know. I can't breathe. I feel lightheaded. I feel like I'm going to pass out. I don't know what's going on with me." And Tiffany had to call an ambulance to come for me. So at that time, you know, what was going on with me, the doctors had contributed it to what was already going on in my medical history, and they completely overlooked the fact that it could have been my heart at that time. So in 2017, I had surgery. After I had the surgery that I had in, I believe it was March of 2017, April. It was April of 2017. You know, I started to feel better. Things in my body were feeling better. I was feeling better. I was feeling like I was getting back to my old self again after I had surgery in April of 2017, which was completely unrelated to my heart. You know, and I felt good. And Tiffany was concerned at that time because we were getting ready to go on another vacation. We were going to Colorado that year. And I told her, I'm like, "Don't worry about me. I promise you I'll be fine. I had surgery. I feel great. Whatever." So it wasn't until the latter part of 2017 when the symptoms that I experienced in 2016 were coming back again. And again, the doctors were like, "Okay, we don't know what's going on. You know, you had this surgery. We removed all of the stuff that was causing a lot of your problems medically. You know, you're much better. You're stable. You know, whatever." But something was not right, and I knew something was wrong. So in 2018, they did a lot more. Towards the end of 2017, 2018, they started doing a lot more tests on me. They sent me to a cardiologist because that's when they decided, like, hey, maybe we're overlooking something that's going on with her heart. Of all the other medical things that she has been through, it would not be a surprise if something was going on with her heart. So they sent me to a cardiologist. I met with a cardiologist who then sent me to a specialist, who then sent me to another specialist. and between the two specialists and the cardiologist, they had all concurred that I had a diagnosis of supraventricular tachycardia and atrial fibrillation, or what they call AFib. So I was put on all these medications. I was taking my heart medication. When I started taking the medications, I was feeling better. I wasn't having so many episodes of SVT. My SVT episodes were far and few between, and then they started coming back again. And when they started coming back again, they were pretty strong. So I went back to my cardiologist, who then sent me back to a specialist who said, "Listen, you need to have this surgery. You need to have this heart surgery." And when he explained the procedure to me, I said, yeah, nah, I'm not doing that. It's a 6-hour surgery in which the electrophysiologist, or he's a cardiologist, but he's a specialist that they call an electrophysiologist, will go in, stop my heart from beating, will take a laser and burn out all of the heart tissue that does not get the good electrical signal that causes my heart to beat at a regular rhythm. And then they will restart my heart, and they said that, I'll be in the hospital for a day or two and then I'll be fine. When they explained how that procedure works to me and the fact that it's anywhere from 4 to 6 hour procedure, I immediately said no. I don't do well with anesthesia. I have a lot of medication allergies. Anesthesia is very hard on me. I've been through enough surgeries that I don't want to do it anymore. I don't want to go under anesthesia, and I don't want to have any more surgeries. I'm over that in my life. I just don't want it. So they gave me another option, which was to have a pacemaker put in place. A pacemaker is a device that sends electrical shocks to your heart, and it regulates your heart rhythm. So for me, my heart rhythm goes anywhere from a normal heart rhythm, which is 50 to 100 beats per minute. My heart rate will go from anywhere from 50 to 100 beats per minute up to 140, 150, 160, and my highest was 170 for no reason. That's how my heart works. It'll go up to 170 beats per minute for no given reason. So the pacemaker was put in a week ago yesterday, as a matter of fact. I chose to have the pacemaker because I did not want to have, any more invasive procedures. I did not want to have any more invasive surgeries. So then the doctor changed my heart medication. So, whatever. Since having the pacemaker, I have felt better over the past week. I haven't felt as horrible, because when my SVT kicks in and my heart rate goes to, anywhere from 130, 140, 150, 160, 170, after my episode is over, which usually lasts about 10 to 15 minutes, and then my heart rate goes down to a regular rhythm, I'm exhausted. I'm so drained. I'm so exhausted. The room is spinning. My head is killing me, and it's miserable. It is absolutely miserable. Since I've had the pacemaker put in, the pacemaker has been regulating my heartbeat to, I think the highest my heartbeat has gotten since having the pacemaker is like 90. However, yesterday, my heart rate got up to about 115, but then the pacemaker was like working fast, and it was like lowering my heart rate, and I could feel it, and I don't like it. I don't like the way that it feels. So today I'm going back to the specialist. He is going to check on the pacemaker, as well as talk to me about, I know he wants me to have that surgery, but I have chosen to do a third opinion. I wanted to see another doctor. Even though I've seen 3 doctors, I now want to see a 4th doctor about my diagnosis and what other options that I have before I choose to do anything. The pacemaker was originally put in that I was only supposed to have for up to at least 5 years to help retrain. My cardiologist and my electrophysiologist was hoping that the pacemaker would retrain my heart to beat at a regular rhythm, because I am still young. They're hoping that my heart is retrainable. It's not that I don't trust my doctors. It's just, it's never a bad thing. It's never a bad thing to go to multiple doctors and get multiple opinions and take each one of their suggestion and, sit down with your family and decide what it is you think the best course of action would be. Heart disease in women is a silent killer, ladies. We don't have the normal signs of heart attacks that men have. Men usually get the left arm pain, the crushing chest pain. For women, it's not like that. It's not like that at all. I can tell you now, it's not like that at all. And women, you get some lower back pain. Your arm might be feel a little off. It doesn't really hurt, but it feels not right, your left arm. But it also feels more like you've got heartburn than anything. And so that's why a lot of times in women, a heart attack is undetected, because we think that we're just having heartburn. Ladies, I'm telling you, it is never a bad thing when you feel like something is not right with your body to go to the doctor and be checked out. Even if everything checks out normal, if everything checks out fine, so be it. But never be afraid when you feel like something is wrong with your body to stand up and say, hey, something is not right and I want to know what it is. Nobody knows your body, ladies, better than you do. So anyways, I'm on my way now. I got to pick up a prescription from my pharmacy, and then I'm headed back to an electrophysiologist. My electrophysiologist is going to be checking my pacemaker, making sure it's working properly, and then I'm going to see another electrophysiologist who's going to look over all of my tests, all of my labs, all of my EKGs and my echocardiograms, and hopefully he's going to give me an opinion on what he feels, and what he thinks is the best course of action. And of course, if this doctor concurs with the other 3 doctors that I've seen, then, I'm going to have to weigh out my options to keep the pacemaker for the next 5 years of my life, or just go ahead and have the surgery and see how I feel afterwards. So, I don't know. Wish me luck, guys. Ladies, please, I urge you, if you feel something is wrong with your body, get it checked out. You never know.